Hello everyone. Welcome to Enzyme MBBS, where complex medicine becomes simple and exam ready. Okay, without wasting any time, let's get started. Vascular events of acute inflammation. This is a very important question because there are three questions that you can never forget. One is vascular events, one more is cellular events, and one more is cellular mediators. Now, in this three question, one question will be definitely there in the final exam, and sometimes what they do is they will combine all these three questions and ask us a long essay. So that's the significance of this question. So answer in such a way that the examiner becomes fan of your presentation. Okay, so start with the introduction. Just write acute inflammation is characterized by vascular events and write the purpose, why basically vascular changes happens. This happens because you have to deliver the circulating cells, right? You have to deliver whatever that is needed in the site of infection. So you have to deliver circulating cells, you have to deliver fluid, you have to deliver plasma proteins. So all those things from circulation is delivered to the site of infection in the vascular events. So first thing, that is changes in vascular caliber and blood flow. So here you have to mention 2 points. The first thing is transient vasoconstriction. Now many of you may ask, wait, vasodilation happens, right? But see, vasodilation is the main event here, but before vasodilation, there is a transient vasoconstriction which occurs immediately after injury and lasts for only seconds. Okay, and this is mediated by neurogenic reflexes and it has no major pathological significance. Then you're coming to your favorite, that is vasodilation. See, this is one of the earliest and important events, and it mainly involves arterioles and postcapillary venules. And this is obviously mediated by histamine, nitric oxide, prostaglandins. Now all these are cellular mediators. They can be asked a separate 5-mark question. We will discuss in upcoming videos that. And yeah, all this vasodilation will result in one thing is increased blood flow. There is a proper term for it. It is hyperemia. Write it. It gives you the bonus. Okay, so increased blood flow, hyperemia, and local heat, that is scalor, and local redness, that is rubor. These are nothing but the cardinal signs of inflammation. Everyone knows it, right? Okay, now coming to the increased vascular permeability, that is vascular leakage. So increased permeability of postcapillary venules allows plasma proteins and fluid to escape into extravascular space. Why permeability increases? Because so that whatever the plasma proteins and fluid is present in the inside the blood vessel can escape into the extravascular space. Now how this happens? There are various mechanisms for it. So let's see one by one. First one is endothelial cell contraction. Now look at the diagram. There is blood vessel and you can see the endothelial cells there. Now histamine, one of the mediator, comes and causes the vasodilation. In that, what happens, more than vasodilation, I can say here the endothelial cells contract. So you can see there the increased gap between adjacent endothelial cells, and through that gap, all these things escapes. Okay, and there are some more mechanisms here which we will discuss in the cellular events of inflammation. Okay, how it escapes and what all things happens. Now coming back to the endothelial cell contraction. See, this is the most common mechanism and it is mediated by histamine, bradykinin, leukotriene, substance P, and it causes formation of interendothelial gaps. Obviously, you can see those interendothelial gaps in the diagram, and it begins rapidly after injury, and it is very short lived. Okay, it lasts for only 15 to 30 minutes. That's why there is another name for this, that is immediate transient response. Remember, transient vasoconstriction lasts for seconds, transient response that lasts for only 15 to 30 minutes. Coming to the endothelial retraction, there is something called as endothelial retractions, which is caused by the cytokines like interleukin 1 and tumor necrosis factor. So here the reorganization of cytoskeleton happens, and here because of the cytoskeleton is rearranged, it takes a little time, so the leakage begins after 2 to 12 hours. And next mechanism is direct endothelial injury. So this is seen in severe burns and microbial toxins. So this leads to the endothelial necrosis and detachment, and leakage is immediate but sustained. Okay, it is sustained for a long time. Endothelial cell contraction is sustained for only 15 to 30 minutes. Whereas this direct endothelial injury, this is also immediate, but it is sustained. So there is again another name for it, that is immediate sustained response. I hope that is clear. Now coming to the next mechanism, that is leukocyte mediated endothelial injury. Leukocyte adheres the endothelium and releases some reactive oxygen species and proteolytic enzymes, causing endothelial damage during inflammation. And one more mechanism is increased transcytosis, that is process of transport of fluids and proteins through channels called vesiculo-vacuolar organelle. What is that channel name is called? Vesiculo-vacuolar organelle. When you're writing the answer, just underline it or make a cloud around this vesiculo-vacuolar organelle. It will be good for you. And this particular process is enhanced by the VEGF, that is vascular endothelial growth factor. So this is about the mechanism. So first you write the introduction, then you mention about the two different things, that is changes in vascular caliber and blood flow and increased vascular permeability. And under increased vascular permeability, you are going to explain these 5 mechanisms. Then write about exudation. What is exudation? That is basically nothing but escape of fluid, plasma proteins and blood cells into tissues. If you notice, when we talked about the purpose of this vascular events, there we discuss this point, right? Because we basically need to deliver the fluid and plasma proteins to the site of injury. So for that, it has to come out from the blood vessel. That is what exactly happens in the exudation. Escape of fluid, plasma proteins and blood cells into tissues is nothing but exudation. Now, there is something called as exudate and transudate. I hope you are familiar with these terms. If not, see, exudate is something which is exudate is a fluid which is very rich in protein, whereas transudate is a fluid which is very low in protein. Now, if you carefully observe, in the normal condition, there is protein circulating through the blood, right? So when this extravasation happens, now the protein goes out along with the plasma. So outside becomes exudate, whereas inside the protein level has gone down. So it becomes like a kind of transudate. Okay, so basically since it is going out, we call this process as exudation. So write that escape of fluid, plasma proteins and blood cells into tissues, protein-rich fluid is called as exudate, and it leads to the tissue edema. Obviously, you have learned this in the first year biochemistry itself. If protein goes out, that is mainly albumin is lost, colloidal osmotic pressure decreases, so it is nothing but edema, right? Extravasation of fluid. And why this happens? Obviously, to deliver antibodies, complement and clotting factors. That is the purpose of this thing, right? First only we discussed. And look at that diagram. Draw those diagrams. These diagrams are from Robbins. And this is a way of also impressing the examiner. Draw that, and it even gives a standard to your answer, and it is very simple, right? Look at that first. See, it is in the normal condition. Your written hydrostatic pressure is equal to colloid osmotic pressure. See, hydrostatic pressure is a pressure which basically pushes the fluid out of the blood vessel. Okay, that is hydrostatic pressure. Whereas colloid osmotic pressure is a pressure that is pulling the fluid into the vessel. So that's why when albumin is lost, colloidal osmotic pressure lost means a pressure that is pulling the fluid inside the blood vessel is lost. That's why the fluid goes out. Whereas hydrostatic pressure, it is basically pushing the fluid out. So when this inflammation happens, when the vasodilation happens, the hydrostatic pressure increases because colloidal osmotic pressure decreases because of loss of proteins. So that is what that both diagram symbolizes. So draw it, and some examiner also expect you to write the differences between exudate and transudate. Now, differences between exudate and transudate, it is a separate 5-mark question, and of course we are going to deal it in another video. Here I will just give a gist of it, main differences. Of course I have written all the differences for the answer sake. You can just write it. But yeah, we are gonna discuss it in a separate video. But talking about the main differences, see, exudate is mainly caused in an inflammatory process, whereas transudate, it is a non-inflammatory process. And if you see the mechanism, why exudate formation happens, because of increased vascular permeability. And why transudate formation takes place, it is basically nothing but the ultrafiltrate of plasma, right? the inside we just talked before, due to increased hydrostatic pressure with normal vascular permeability. And appearance, color, all those things are just observations. The protein point is very important. In exudate, protein is very rich, that is, it is greater than 2 gram per deciliter, but in a transudate the protein is very low, it is less than 2 gram per deciliter. And apart from that, yeah, character of edema, fibrin content, obviously protein is more means fibrin is more, protein is less means fibrin is less. All those things are simple, so just write that table, you're good to get marks. And then write about the stasis, that is nothing but the slowing of blood flow. That is, see, loss of plasma happens, right? The plasma is lost from the blood vessel because of increased vascular permeability. So increased blood viscosity. Now you may ask me that, wait, proteins are lost from the blood, so plasma is also going out, which is a liquid, protein is also going out, which is a solid. So how does the viscosity increases? If you carefully observe, proteins go out, but the RBCs, that is red blood cells, their concentration is going to increase. I mean, it's not like extra RBCs are produced and concentration is going to increase, but the fluid which was balancing the concentration of RBC has gone out. So there is a comparative increase in the concentration of RBC, right? So concentration of RBCs in small vessels at site of inflammation. So basically here you can see dilated vessels with slow moving blood, and this causes the stasis, write it. And last but not the least, write about the leukocyte margination. Leukocyte margination, you can write it in the cellular events also. It's like in the 12th you studied about the transition elements from S block to P block. There is a transition. So it's a kind of leukocyte margination is a transition between the vascular events and cellular events. So mention it here also. Due to stasis, leukocytes moves to the periphery of vessels. Basically, before what was happening, the blood was moving constantly, so the leukocyte was moving through it. But now the movement of blood has become slow. So now what happens is leukocytes, because of that slow movement of blood, the leukocyte move to the periphery of the vessels and they begin to margin. That's why we wrote leukocyte margination. And then they are now set for the stages for rolling.